Hello, you're watching Studio Ken. Make sure you don't miss any episode of Studio Ken by subscribing to the YouTube channel. To subscribe, search for Studio Ken on YouTube, click subscribe on the bottom right of your screen, and set a reminder. You can also watch Studio Ken on Diamond TV on Wednesday at 18:30 and on Saturday at 19 hours. Studio Ken, the home of Kennedy Gondwe on YouTube.
There can be no question that being able to achieve and maintain an erection is physically and psychologically very important for men. But what happens when the dude can't get it up? Unlike women who aren't so cagey about confronting health concerns, some men would rather suffer and die in silence than open up. Even for the most confident of men, such a conversation is never easy. On Studio Ken today, the focus is on a condition known as erectile dysfunction.
Dear Mama, I'm chilling with Studio Ken, and I know that you're proud of me. Yeah, man. My name is Super Fantastic at Libido, just B-Flow. You're now rocking with Studio Ken. Remember to hit the subscribe button. Chances are.
Joining me to shed more light on erectile dysfunction is Dr. Aaron Mujajati. He's a specialist physician, former president of the Zambia Medical Association, and is also an author. Doc, welcome to Studio Ken.
Thank you.
We'll talk about the issue of erectile dysfunction and the problems that it causes to men a little later. But how serious is it a problem in Zambia?
It is quite a serious problem, although you have to take that in context, in the sense that not so many men want to come forward. Especially to us, the conventional doctors. You will also have to also take into account the fact that there's a research that was done recently where it was revealed that 70% of Zambians would, first of all, if they have a health problem, they will begin by going to a traditional healer before they come to a facility like ours. And bearing that in mind, you will also notice that traditional healers who sell concoctions that promise prowess, whether it's to do with penis enlargement, whether it's to do with a stronger erection, those traditional healers have found a niche market. So you'll find that because most people would rather go to a traditional healer first before they come to us, the size of the problem is not very well defined. But that said, if you look at anecdotal information or data, you will find that the problem is quite huge. And the drivers of the problem are quite many.
Why don't men want to come forward to discuss issues to do with erectile dysfunction?
I think naturally, as men, psychologically, we have a very intimate relationship with our genitals. It's not just in the African culture, it's just across cultures. Men compare the size of the penis, and men want to, when they're having beer with their friends, want to talk how many rounds they did, as some sort of a bragging right, if you like, and they want to talk about their sexual prowess, their sexual explorations, if you like. So, having said that, you will find that if a man has a problem in that area of erectile problems, rarely would they want to come open, especially to their friends.
A bit ironic there, Doc, because you'd expect men then to come forward when they've got problems, because according to what you're saying, they easily brag about their prowess in bed.
Yes, I think it's the way we have looked at ourselves as men. Generally speaking, it doesn't matter whether it's erectile dysfunction or any other illness, men hate to go to the hospital. Men have a general fear for hospitals. It's a real fear. The other reason is that when a man admits that he's unwell or he's sick, I think in the psyche, it's an admission of weakness. So most men would rather not say. And if you noticed, even when you go to any hospital that admits patients, you will find that men come to the hospital very late. Either he has come because he's unconscious, either he has come because they carried him because he can't walk anymore. So we report problems very late. Why that is, I don't know. But specific to erectile dysfunction, it has to do with ego. It has to do with, when a man can no longer have a good erection, it starts to weigh on their mood, it starts to weigh on their psychology, it starts to weigh, for some they even develop depression. And so that particular area of function in men is extremely, extremely important. And any problems there, they are linked to either weakness or ego or just something has really gone wrong.
Isn't there pressure also exerted on men by their girlfriends or wives to satisfy them between the sheets?
Well, there's that, but there's also pressure from friends. There's peer pressure. These conversations where you are sitting around a beer and one of your friends is boasting that he just had 5 rounds. In as much as we know that that's not naturally true, but I mean, those stories stick. If my friend has had 5 rounds, how come I can only do 1 or 2? There must be something wrong with me. And that's how, these concoctions also have found their way or have found a place. So the pressure is both from the women, but also from fellow men.
So what is a normal number of rounds?
As in naturally?
Yes.
I think tops, 2 to 3 tops.
Over what period?
Because remember that if someone has had, say, an ejaculation for the first time, to get a second erection, it takes a bit of time. They'll need to wait and rest a bit to get a second one. And at the second occasion, they'll last a little longer than the previous one. Now, remember that sex takes a lot of energy. It takes a lot of energy. You would have to have a super energy reserves for you to go 3, 4, 5 in one night or one evening. Very unlikely.
So what would you say is the percentage of men in Zambia having problems with getting it up?
I don't have the actual numbers in terms of here is the problem, here are the statistics, because but if you look at the demand and if you look at the number of men who visit the clinic because of such problems, one would imagine that the problem is quite big.
There are men in Zambia who are addicted more or less to drugs that are sold, be it those that are sold traditionally or through the pharmacies. I mean, we've been told stories or hear of stories where people are advertising drugs that can make a man last in bed for up to 7 hours. Is that true?
It's big business, and it's big business because of perception. And you have all these concoctions, both traditional and conventional, that people use. Now, on the conventional side, yes, there are drugs that can help you strengthen an erection if it's weak. But don't take these drugs without the advice of a practitioner, because they come with, side effects. If you take the commonest one, Viagra, for example, it has issues with affecting your BP. So if you have a heart condition and you go and prescribe, do self-prescription of these drugs, you end up causing problems. We've heard stories of very famous people who've died while in the act, okay, because of taking these medications without following proper protocol. And we've also seen men who've come with priapism. Priapism is where you have a painful erection that will not go away. Now, priapism has a few problems with it. Remember that the mechanism of an erection is that blood flows into the manhood or the penis. It is blocked in there for the erection to stay there. But if it overstays, remember that blood has to flow in and out. But with an erection, blood goes in, it is blocked, so the erection can stay. Now, that mechanism has a specific number of hours or minutes that it can stay like that. At some point, that blood has to flow back. Now, if you've taken something and you have this prolonged erection, the tissues of the penis begin to die. And then the erection becomes painful. And that's what we call priapism. If it lasts long enough, the penis would actually die. It will never erect again. And that's why we always encourage people not to take things that they don't fully understand.
You run CarePick Specialist Clinic here.
Yes.
What do you tell your clients that come to you with such problems? And mind you, there are those clients that may come genuinely because they are having problems with their penis. But there are those that come here, I would assume, with problems as a result of them overdosing. What do you tell these categories of people?
Yes. You see, for people who come to a clinic like ours, especially men, because we do have a men's clinic here, which is run by one of our specialists. So the things we tell men when they come here is, first of all, we need to diagnose why you are having a poor erection, for example. We need to diagnose why you are having early ejaculation. Or we need to diagnose why you can't even have an erection at all, because there are those who just not have an erection at all. It has just gone. And for different men, the reasons are different. Okay, there are some who would have a poor erection purely because they've been unwell for a long time. Chronic illness can give you a poor erection. There are some because they have poorly controlled hypertension, or they have poorly controlled, they have very high cholesterol in their system and the tubes are blocked because of high cholesterol. There are some purely because maybe they are diabetic and the nerves have been affected. No, diabetes affects nerves. So if the nerves are affected and the diabetes has been poorly controlled, they may have, erectile dysfunction. There are those who may have had trauma, either trauma due to surgery or trauma due to an accident. There are some who may have had, say, cancer around their manhood and they underwent, say, chemotherapy or they underwent radiotherapy and things got damaged in the process. So it depends on why people have come. And that is why we always insist, as a man, if you notice that you're having issues with your erection, do not try to self-medicate. Don't try to go and drink things you don't understand. At the very least, at least go to a facility such as ours or any other facility where they would be able to give you a diagnosis. Because at least if you have a diagnosis, it's a lot easier for you to even try and read up on your diagnosis. If it means you want to try and use a natural or traditional remedies, at least do it with understanding. We are not saying that I'm one of those who would not argue, who would not disagree to say that there are natural or there are herbs out there that can help people. Those herbs are there, but do it with understanding, and that's what we keep telling people.
What is the traffic like of people coming here with those kind of problems?
It's relatively high. In fact, I think that it's the commonest problem that we attend to here.
This is not an area that most men would talk about. What is your experience like dealing with such clients?
Usually, you would expect that, I've seen this happen quite a couple of times. A man would come, sit in front of us with a different problem altogether. And they'd be going around in circles over that problem. And you can see that even the problem they're describing is not actually the problem that has brought them here. So they'll go around in circles before they come to the problem. And because of the experience that we've had, for example, when a man comes to this clinic and they have, say, hypertension and they've been on antihypertensives for a very long time, we are very direct. We will ask you, how is your erection? You've been taking these drugs for this long, or you've been treated for this condition for this long. How is your erection? You've been diabetic for this long. How is your erection? Or you underwent surgery. How is your erection? Or you had that accident. How is your erection? Or you are obese. You are overweight. How is your erection? So here we deliberately bring up such conversations in men because we know that left to himself, the man will not say.
So you ask, how is your erection?
Yes, we do.
How is your erection? How is your erection?
We ask, yes.
What is a normal erection?
Well, by definition, erectile dysfunction is inability to obtain and maintain an erection for both sexual pleasure and procreation. Yes. So it's about obtaining an erection and maintaining it. So for some people, they can get an erection, but they can't maintain it. By the time they want to start having sex, the erection is not strong enough for penetration. And yet when they started, it was there, but by the time they want to enjoy sex, they cannot penetrate. So that is a form of erectile dysfunction. Another, based on that definition, there are some people who just cannot obtain an erection. It's just not there.
And there are those that ejaculate quite early,
yes,
even before they penetrate.
Yes. And then there are those who have lost the desire for sex, as in low libido. There's just no desire for sex. It's also part of erectile dysfunction.
What causes that?
Different things. Some people it's psychological, depression. Some people it's medication that they are on. For some people, if they had been sick for a very long time, it can cause that. So it depends on the person who has come and what is causing them not to have the desire for sex. Because in a man, lack of desire for sex is a very serious issue, because men by nature love sex more than women do. Yeah.
And what pressure do you think that is having on people's marriages?
Too much. And usually you will find that women are long suffering, and so, I've seen situations where I find that the woman knows that probably my husband may have a problem in this area, but they fear to even raise it. And so sometimes we encourage couples to talk about these things. But I think that traditionally for women, I don't know, maybe they're not allowed to raise such issues in their home, I don't know. But some women, they do, contact us and say, Doc, look, I think I have this situation in my home. How can you help? So we have very tactful in the way we deal with the matter. We would then encourage her to say, okay, see if you can come with your husband here and see if we can engage him from man to man. Because you as a woman, you may not know how to approach a man to man. It may be a bit of a challenge.
Yeah. Don't you also have cases where women would call you and say, I'm being overworked in bed, it's too much of him? We read about these stories in the Sunday papers.
Yes, of course. I mean, those situations are there, especially if a man has taken something, where he has this erection that has gone forever and ever and it's not stopping. But again, remember what I talked about? I talked about priapism, that if you take such concoctions, be careful not to damage your penis, because you will damage it. If blood overstays in that space and it's not backflowing back in time, you will actually kill the penis. It may die. Yeah. So, and it's true, men do take concoctions, both traditional and conventional, to help them with their prowess.
Yeah. So what would you say is a happy couple sexually?
You see, it's the challenge you have with sex is that it's highly individualized. Yeah. So it's very difficult to give a prescription and say a couple that does this is more happier than the one that doesn't. So it's very individualized. But at the end of the day, I think the happy couple is one where both man and woman are equally served. Equally served, I mean they are satisfied with what they are getting. Yeah. You may have married a woman who wants more of sex than you do, and for her to be happy, it means that you have to make sure she gets more of it. You may not need it much.
How do you strike that balance?
I think what helps in striking the balance is to talk about it. But unfortunately, most couples don't discuss sex in their homes.
And what do you tell such couples?
We would actually encourage them to open up and have open discussions in there as a couple, to discuss it, talk about it. Between the two of you, talk about it. Let your partners say if they are finding it satisfactory or not. And even yourself, you should be able to say what works for you and what's not working for you. Because without that discussion, it's very difficult for you to know as a man whether you are doing the right things for your partner or not. Otherwise, you keep guessing, because what people want from a relationship or from a sexual relationship is very different. I mean, what you want from a sexual relationship is very different from what I would look for. And it's the same with your wife or your girlfriend or your partner. What they want is very different. You can't assume. And usually the mistake we all make is we assume that we have done what the person wants, when in fact not.
What is a normal frequency for sex? Every day? Weekly?
Again, it comes back to what I said earlier, that you cannot issue a prescription. But you should be worried if you're in a relationship that doesn't have it.
Shouldn't you be worried when you are in a relationship that is having it hourly or every after each meal?
There are psychiatric disorders of sex, and you also need to be mindful of that. Yes, there are some people who have abnormally high libido, desire for sex, which is outside the normal desire for sex, and they would actually want it even more. And it happens in both men and women. And if you feel your partner has such a problem, they want sex Because at the end of the day, look, life has to go on. At the end of the day, you have a job to go to. You have to go and make money. You can't be having sex every hour or every 2 hours or every 6 hours. It's just not possible, because your other life has to proceed, has to go on. So there are those disorders where people have a heightened desire for sex, where their libido is just too high or outside what is considered, normal. You see, you can't have sex to a point where it disrupts your normal life. Yeah. Then if sex for you is disrupting your usual activities, you can't even attend to meetings, you can't even go for work because all you want is to have sex, then you probably need help. You could have a disorder.
Do you have people that are addicted to sex in your dealings with the different clients that you have?
Yeah, once in a while you get those, but they're not many. Once in a while you get those, yeah.
How much of traditional teachings affect positively or negatively sexual activity in marriages or relationships?
It does have an impact, because you see, the way, for example, the way a couple would communicate such issues in a home, it depends on how they were raised and what they were taught or what they were advised to do traditionally. Because the way people would communicate to each other has a huge, our traditions and cultures has a huge bearing on how we interact with each other. I do not think that sex is a very easy to discuss subject in our communities, let alone in a public discussion, even in an interview like this one. It's a very uncomfortable topic, and that you will find that because it's a very uncomfortable topic culturally, not much free discussion goes on there.
And what is your advice as an expert in as far as opening these conversations is concerned?
Yes, I think that in the context of a couple, I think that couples should be encouraged to talk about these things. Talk about your frustration, talk about what works, talk about what's not working for you, and be very open about it in the context of your relationship. Without that, it's extremely difficult for anybody to guess whether what you're doing for your partner is working or not.
How can females help their partners in as far as these problems are concerned? Because there are two sides of the coin.
Yes.
You get stories of females that say they are overworked, and then there are also those that are sexually starved. Yes. But at the same time, that happens with men. How can the two partners help each other?
Yes, it will still go back to communication, but again, it matters how you communicate. You see, if you know, for example, you know that psychologically, sex is a lot more important to a man than it is to a woman, and you are a woman. And you know that your partner is having problems with an erection. If you will go in with a judgmental attitude, the man would just raise a very big Chinese wall, and he would never, open up to you. So you need to be very gentle in the way you want to approach him, so that he can also come out. Sometimes you find that the man is starving his woman of sex, not because he doesn't want to, not because he just doesn't want to give her the sex. It's probably because he's actually hiding a problem. His problem is that he's probably not having, he has issues with his erection, and his fear is that if I tell this woman this matter, I'll go and hear it from all over the place. So women also need to be very gentle. And men also need to be gentle and understanding. Because if you flip the script, you'll find that as men, we equally need to be very gentle, so that she's able to tell you openly what's going on. So you will find that a lot hinges on communication in the couple.
How about men that have multiple sexual partners? There's some men that believe that variety is a spice of life. So the more you have, the better, because you get different levels of satisfaction.
I think polygamy is, for most African cultures, it's a cultural issue. It comes from our background as a people, and the practice has been around for a very long time. Very difficult to speak into it as a professional, from a professional standpoint, because it's a cultural matter for most people. especially for most African cultures. From a Christian standpoint, of course, polygamy is frowned upon in the Christian teaching, but from a cultural standpoint, it's something that is openly practiced. Yeah.
And women that have got multiple sexual partners as well?
Yes, you do see those. And in some cultures in Africa, you will find women who are allowed to marry more than one man, and they can keep more than one man in their marriages. There are cultures that do that. But in ours, particularly here in Zambia, it's actually frowned upon to have a woman who has several men around her. It's actually it's not something that is morally accepted for the Zambian culture.
If I walked into your clinic and told you, Doc, I've got problems with my ejaculation. I come early sometimes, or I can't just get it up. What would you be telling me?
Yes. So if you came and you have problems with your erection, the first thing we will do is take a history from you. You would then tell us, when did it start? How have you noticed the problem? So you will give us a chronological order of the problem. We'll also go into issues of severity, issues of desire for sex and things like that. Because we'll also go into issues of whether is it that you can't have an erection or is it that you can't maintain an erection? Yeah, there are those. And then we'll now go into your past medical history, because your medical history in this situation will matter. Because, for example, there could be drugs that you're taking that may have an impact on your erection. You could have an underlying medical condition that you're being treated for, yes, but that particular condition, if it's not properly managed, it has an impact on your erection. For example, poorly controlled diabetes has an impact on your erection. Is it that you had some form of treatment, or, for example, if you had cancer of the prostate and the prostate did spread and it caused issues, you might have that. Did you have a disease of your testicles that ended up causing a low production? Did you have issues to do with blood supply to your testicles that they shrunk? Okay, because the size of the testicles also matters. If they are tiny, were you born that way? There are some people who were born with certain hormonal imbalances that does not just allow them to have the problem. So is it that, have you ever had an erection before, or you've just never had it before? Were you born that way? Did you acquire the problem? So there's that issue of the history. So history will tell us where we should now direct the tests. Then you will undergo some tests. So we'll draw blood from you. We would even do some scans on you to check exactly what's going on. Once everything is put together, then a diagnosis will be made.
What is a normal size of a penis and what is a normal size of testicles? We've seen or read about stories where a penis actually shrinks or sinks between the testicles.
Yes. I think in terms of size of the penis also depends on where you come from. Africans tend to have, on average, larger manhoods than most races. There's a study that ranked the size of penises across Africa, and different countries ranked differently. But you will find that most men desire to have a very large penis. Partly what drives that is the porn industry, the pornographic industry. They sort of drive the need for a much, much larger penis because most people who participate in those movies, generally the industry picks men who deliberately, either through surgery or something, or some form of manipulation, have very large penises. And so for most men, when they look at that, they think that's the normal, but it is not. Yeah. In terms of girth, penis, well, it shouldn't go beyond, what's this? The largest, if one has a penis which is anywhere between, in terms of girth, 2.5 to 3.5, 4 centimeters, or millimeters, 4 centimeters, right? 3 centimeters. Yeah, 3 centimeters, it's fine. In terms of length, you're talking about 16 centimeters, it should be fine. Yeah. And of course, on average, for most men, their penises are slightly longer than 16 centimeters, and I'm picking the average here. But most people want it long and big.
And testicles?
So the size of a testicle depends on your age as well. There's a nice machine, no, not even a machine, it's like beads called an oxidometer that we use to measure the size of your testicles. Yeah. So in terms of size, you're talking about 2 by 3 or 2.5 by 3.5. It should be the average size. Yeah.
Is there anything like thick sperms? We've seen traditional doctors advertising thick sperms.
Well, different people say different things. I think what is important with sperm, we need to distinguish between what we mean when we say sperm and what we mean when we say semen. Yeah. So semen is the fluid within which the sperm is carried. Sperm is the actual cells. So when they say thick sperm, technically to me, it doesn't sound technically correct.
Is there anything like thick semen?
Well, not really. No, I don't think it's something that is... There's no such a disorder where you would even give medication for someone to go and thicken their semen or make it light. No. At the end of the day, what we worry about in terms of production is the nature of the semen. And the nature of the sperm, not the semen. The nature of the sperm is the sperm the correct morphology? Is it of the correct motility? Is it of the correct morphology? Some sperm, you'll find that they don't move as actively as they should. Some you find that they have sperm which has 2 or 3 tails when it's supposed to have 1 tail. Some you find that they have sperm with 2 heads and it's supposed to have 1 head. And such defects in sperm, depending on the proportion of the defect, some even if they have the sperm, but because they have these defects, they are not useful. So that's what we look at when we are analyzing sperm.
Doc, thank you very much for hosting us in your clinic.
Thank you.
Dear Mama, I'm chilling with Studio Ken, and I know that you're proud of me. Yeah, man. My name is Super Fantastic at Libido, just B-Flow. You're now rocking with Studio Ken. Remember to hit the subscribe button. Chance it on.